ER was called at 12:20, and he drops the phone before noon.
Right. I mean, he is someone who knew he did something wrong. I think he panicked in the moment. He didn't react quickly with the resuscitation. He didn't call 911, and he didn't give an honest account of what happened once he got to the emergency room. This is someone who got caught after making a deal with the devil and then had to pay for it.
What is the potential danger, and how reckless is that?
Well, this is really reckless. I mean, in my mind, this further illustrates his lack of judgment, his poor judgment, and operating way below the standard of care. When you leave propofol in a common area, anybody can take it. This is a drug that can be abused intravenously, so anybody of an age that knows how to do intravenous drugs could steal this or sell it on the black market. It's extremely irresponsible.
What does the prosecution need to do to make sure that the defense, in its case, doesn't confuse us with so many milligrams and milliliters that they basically throw up their hands and they say, I'm confused, that's reasonable doubt?
Well, I think that they would be well served to sort of paint a very broad picture, because it's really hard to ask jurors to understand medical testimony. And you're right, it's very confusing. Milligrams, milliliters, how much is normal? They don't know. We don't expect them to know. I think what they should do is return to the big picture. There's a cardiologist practicing a specialty he's not boarded in. He's doing it in home, which is completely inappropriate. He's doing it without monitors, and he doesn't even know how to do CPR. So this is a doctor that's exhibiting very poor judgment, and whether the jury understands milligrams or not, it really shouldn't matter. It's a cardiologist doing anesthesia.
You were telling me this is not ever supposed to be in the saline bag.
Absolutely not. I mean, when most people run a propofol infusion in a hospital setting, they'll connect an attachment that runs through one of these side ports. So it'll be a separate access port that runs it. If you cut open the bag and put the bottle inside, you're sacrificing sterility. The outside of the bottle is not sterile. So then you're giving an intravenous substance that isn't sterile. In addition, I don't know, I mean, if that's really what he was doing, that just kind of illustrates his extreme lack of knowledge in this area. I've never seen anybody do it that way. I don't know how he would have jerry-rigged a system to even work like that. So, you know, the idea of cutting open the IV bag and having a bottle in there of propofol doesn't make any sense at all to me. I've never seen anybody do it that way. Well, certainly if he was on a drip, it would be riskier. And I agree with the cardiologist who testified. If you were intending to keep someone asleep, someone who's used to medication, someone who's been resistant to several benzodiazepines throughout the night, it would be unlikely that the plan would be to just give 25 milligrams and then leave. The plan was probably to maintain a level of propofol in the blood. So that would be most likely. Of course, I don't know if that was his plan or not, but certainly if you were trying to keep someone asleep with propofol, you would plan a continuous infusion or a continuous drip.
What did you take away from the guilty verdict in terms of how it's going to impact the medical profession?
Well, first of all, let me just say that I think the guilty verdict was absolutely the right verdict. I think this case is sad in a lot of ways, but one cannot escape the fact that Dr. Murray acted so far below the standard of care. His behavior really was reckless. So I think this sends a good message to the medical community that we do owe our patients that relationship of trust, that we owe them to be in control of ourselves. We owe them to be informed and prudent and educated and in control. I think here Dr. Murray wasn't in control. He was intoxicated by Michael Jackson's fame and by the money, and he made poor decisions.